I'm Terry Bradshaw. Please join me as I leave the field for the boardroom in search of the best and the brightest people willing to share their viewpoints. While keeping the quality of patient care high and the cost of health care low has always been a challenge, industry innovators are providing ways in which to achieve both. The World Health Organization estimates that 1 out of every 10 patients worldwide is impacted by preventable medical errors. These errors include systems failures, human factors, complicated technologies, powerful drugs, prolonged hospital stays, and cost-cutting measures, to name a few. Medical errors such as these can cause serious injury and even death. In the U.S. alone, it's estimated that medical errors result in billions of dollars in excess health care costs each year. Dennis Stover believes the use of certified surgical assistants in the OR can help ensure patient safety and cut health care costs. He serves as president of the Meridian Institute of Surgical Assisting and the Association of Surgical Assistants.
In many facilities, nurses are working as surgical assistants with no training. Patient safety should be the primary focus. I think the best way to do this is through effective informal education. Standardized rules nationwide would assist this, through state-mandated certification and the requirement of formal education as the pathway to practice.
Located in Nashville, Tennessee, the nationally accredited institute provides comprehensive training in this fast-growing field.
Meridian started in 1999. Our initial goal was to develop courses that set the standard, at the same time keeping tuition costs at a minimum. The SFA Online program was developed with the concept that the student must understand why he or she is performing a specific task, followed by the ability of how to complete the actual task.
An advisory panel made up of surgeons, nurses, OR directors, and certified surgical assistants was formed. The curriculum was developed into a 3-stage program: academic, hands-on, and clinicals.
During the academic stage, students learn the particulars of each surgery. The course also takes the patient from the general practitioner right through the postoperative stage, allowing students to understand symptoms, causes, and various treatment methods, as well as why certain surgeries may or may not be recommended.
In the lab, students work with live tissue and real bleeding and perform surgeries in a real-life setting.
Our applied science lab is what separates us from other training institutes. The entire hands-on portion of the course is accomplished in our state-of-the-art animal lab. From Meridian's inception, we felt that in order for our students to really gain the experience necessary, they must have more hands-on training than just working on rubber parts in a hotel room setting.
During the clinical stage of the course, each student must complete 135 cases in a variety of specialties with a sponsoring surgeon or a Meridian-approved certified assistant.
All of our students have past OR experience and are surgical technologists, operating room nurses, or physician's assistants prior to beginning their specialized training. Many opportunities exist for certified surgical first assistants to specialize in areas such as cardiothoracic, neurosurgical, orthopedic, vascular, and other specialties.
Meridian graduate Allison Dobbin-Speck works as a certified surgical assistant at the Myers Sports Medicine and Orthopedic Center in Atlanta.
I was employed as an athletic trainer and considered PA school. However, Meridian offered an alternative. They educated me with the knowledge and clinical skills to become proficient in the OR, assisting a surgeon in any specialty. Meridian opened more career opportunities, increased my salary, and has allowed me to work in the surgical setting.
Surgeons like Dr. Rotkus also recognize the benefits.
A certified surgical assistant provides a skilled assistant who improves the surgeon's safety and efficiency, and they effectively replace the need for another surgeon as an assistant, especially in long and complex surgical procedures. Ultimately, they're cost-saving, especially in the era of an expanding patient population and the relative shortage of physicians, particularly surgeons.
As the demand for certified surgical assistants becomes even greater in the future, the Institute will continue to play a vital role in providing the industry with dedicated and qualified medical professionals.